Your smile says so much to the world around you. If you've lost your smile as a result of age, disease, or an injury, your beautiful smile can be restored thanks to the skilled and caring team at Greater Baltimore Prosthodontics.
This looks all great. You're doing a good job taking care of everything. That's very important. If you look at our patient population in this office, when I do hygiene check, I would say probably 80% of the patients has at least one implant in their mouth.
Once implants are in, you would never know, just talking to someone, that they have an implant. Implants are root replacements. Prosthodontics is a specialty in dentistry that's recognized by the American Dental Association, and it can include dentures, partials, implants, crowns, fillings, but it's someone who's had extra training in order to complete those procedures.
Now implants have a wide array of uses. You can have a single implant, or if you're missing a single tooth, that could be replaced. You can do 2 implants and do an implant bridge for if you're missing 2 or 3 teeth. You can do basically what the concept of placing 4 or 5 implants in a jaw and having a denture that screws in place. That denture never comes out unless we take it out. So we had a chance to look at your x-rays and everything. Nowadays, majority of my implant patients are actually elder patients. As long as the patient is healthy, age is not a factor anymore. I have 92-year-old patients that come in and get implants, and they say it's a great decision. I had a patient that was 92, and he had a prosthesis that he kept breaking it. And I discussed with him, I discussed with his physician, and he was healthy, and we went ahead and did the procedure, and after we got done, he said that was the best decision he made.
The key to all this is the initial decision of what are you trying to accomplish with each patient or with a particular patient. Does this patient want implants just to support a denture? Is this patient trying to replace just an individual tooth? Do they want to reconstruct their entire mouth? Lots of different ways things can be constructed or implants can be used. So we need to determine what is the ultimate goal that the patient wants to achieve. We sit down with the patient and discuss what their desires are, what they're trying to achieve. 2, we discuss what it would be involved in order to achieve those goals and what their options are so that they're informed about what their particular options are. Then we have to do an exam intraorally. We follow that with radiographic examination so we can see what the bone looks like. And then we a lot of times will obtain models of the patient's mouth so that we can take all that information and look at it and come up with a treatment plan. We try to come up with multiple treatment plans so that the patient understands what their options are. And then we present that to the patients and decide what's the best way to proceed. First, we have to establish if someone's a good candidate for implants. Then we look and see is there adequate bone support. And if there is adequate bone support, then we can place an implant in that area. If there's not adequate bone support, what do we need to do in order to create the adequate bone support?
At the first step, if they need the bone grafting, that gets done on the first visit. Nowadays, with the technology that we have, with the growth factors, we can reconstruct almost every defect using just basically off-the-shelf stuff. So there's no additional procedure. The procedure's done in the office. There's no need to do general anesthesia. There's no OR time. Patient walks in, have the procedure done. They drive themselves home. We usually see them for a follow-up at 1 week to take out any stitches, anything that's remaining. And then the patient goes and heals for about 4 months. They could go about their life. There's no special precautions. They got to be careful not to chew on the area, but other than that, there's no special precautions. So after 4 months, they come back in. At that time, you could take a dental scan and see the quality of bone. We could pick out the ideal type of implant for that patient and plan the implant. Sometimes we do it the same day. A patient comes in, we actually do a lot of immediate implants where a patient has a tooth in the front where they break the tooth, they don't want to walk around with a missing tooth, and their general dentist refers the patient to us, or it's one of our own patients that breaks the tooth. And then they come in, we can take out the tooth, place the implant the same day, and we can even, if the implant goes in stable enough, we can put a temporary tooth on there the same day. That way the patient walks in. I have plenty of cases where patient walks in, tooth is broken, they walk out the same day with a tooth on there, and you can't even tell anything happened. There's almost no bleeding afterwards, and they go and they still have to heal for about 4 months, and then we'll put the final crown on there. So the actual tooth part that goes on there, what we do is once the patient's healed up, patient comes back, we take a mold of their mouth. Once the impression's made, then we have our own in-house lab. They pour up the model. We have our own ceramist here, so they can stack porcelain on it and make the tooth out of porcelain. If it's going to be a denture that snaps into it, I mean, we need to make dentures or something like that, we have a denture person here who does the acrylic work and makes the dentures for us. The nice thing about having our own in-house lab is that we can, one is cut down the turnaround time, and two is that we have quality control over everything. A lot of places, if a patient's going to get a single tooth in the front, it's very hard to match the color of a porcelain versus a natural tooth, the enamel on a tooth. By having our own ceramist here, he can walk to the chair, shade the color that he wants, and go back and put the crown in the oven, and 15 minutes later you have the exact match, where if I stand there 2 feet from you, you can't tell the difference. Here at Greater Baltimore Prosthodontics and Periodontics, we're lucky enough to have a group of dentists and specialists that we work together to provide the patient the best care that we can.
We provide quite a large number of different services. We have the prosthodontic support with Dr. Wally and myself. We have a general dentist, Dr. Brooks, who works with us, who provides general dentistry support. So we're able to provide a wide spectrum of support for reconstructing the mouth. We also have an in-house lab where we can provide technical support for dentures and crown and bridge. We have 5 hygienists that work for us, all who have been in dentistry for over 25 years. So they're extremely knowledgeable and very experienced. The support that we have, the experience that we have, makes the patient's overall experience much easier, because between the assistants, the hygienists, the front desk, they all know the right way to handle a patient and to address their needs.
So we can provide pretty much all the services, short of orthodontics for kids. We can provide most of the other services here. One of the other advantages that really sets us apart is because we are all specialists and working together, we can provide the patient the best service. We ask that you don't chew any hard stuff with it. My job is to educate the patient, to give them information. Although it's easy to talk about as a general sense, each patient's specific case is different. You know, something that I would do for one patient is not something I would do for a different patient.
We can usually, for just about any patient, provide some kind of support or some kind of assistance to improve their function and their comfort level. I think the most gratifying cases are the ones where people have been in accidents, whether it's car accidents, bike accidents, being able to restore function for these patients. Taking someone who is just completely unhappy with their dentition and being able to allow them to smile again, it's very heartwarming.
For more information on Greater Baltimore Prosthodontics, visit their website, gbpdental.com, or call them at 410-296-0136.